The whole issue of healthcare reform has certainly been politically divisive and contentious, but not because of the need for reform. I don't think anybody argues that reform isn't needed, that the system isn't broken. The question is how to go about doing it. And from my perspective, there are three essential tenets that are necessary to make healthcare reform work. The first tenet I see is the individual mandate. The individual mandate is important because it really is the basic tenet of insurance, and that is taking the risks and spreading them across a larger population. And the more you cut that population into slices that are unique in their nature, the more difficult it gets to be to insure that population. So the designers of healthcare reform recognize that and realize that the way to accomplish that, the way to attract the good risks and the bad, is to make sure that people actually buy insurance. And so there's a mandate in place into reform that will ensure that those young, healthy risks, while they are young and healthy, still purchase insurance to help subsidize the cost of the elderly, more sickly population, which by itself would be unaffordable to insure. The second essential tenet is the small business tax credit. And that tax credit is designed to make sure that we don't end up with simply a public exchange, a single payer market, that we retain the best parts of the private insurance market that employers are purchasing on behalf of their employees. And the tax credit for small employers is essential for helping to subsidize that cost of maintaining employer-based health insurance. Without that, there's a risk that small employers and even large employers may decide that the tax credits are not significant enough versus the cost of providing coverage, and would end up perhaps dumping their employees on the exchange. That would be a mistake because that would put all of our eggs in one basket and make that unaffordable. The third essential tenet of making healthcare reform work is in fact changing the cost structure, because even if we're successful in making it accessible and drawing in all types of risk into the population, and even if we're successful in making sure that employers continue to offer health care to their employees, if we don't change the trend of cost, we're going to fail. We know that already. We know that even without healthcare reform, the increases in healthcare premiums that private employers are paying is unaffordable, and fewer will be offering them as time goes on unless we change that. So, like the Massachusetts experience that they've seen with the connector, getting access alone isn't enough unless you address cost. And the key is to change behavior. Change behavior for the individual, change behavior for the provider. Make sure the incentive isn't that the more you do, the more you get paid. Make the incentives work to make you a healthier person, and then to treat the person with prevention. Dental benefits were certainly not the focus of healthcare reform, but should have been the model. And I say that because dental benefits focus on prevention, and prevention for a reason, to avoid the cost of restorative services. The medical model is just the opposite. Most dollars in the medical model are spent on fixing something that went wrong rather than preventing something from happening. And that's really why dental works well, and that's why almost every employer in the country has decided, more than 98% have decided to purchase their dental benefits separately from their medical benefits, because they know that these carriers are expert in delivering that type of care. The private market has got it right, and healthcare reform is intending to give those who haven't been able to purchase in the private market the same access, the same cost, the same choice that employed individuals get when their employer offers coverage. Right now, that's not working. Right now, that's been an oversight that needs to be corrected. Dental benefits need to be priced and offered separately from medical insurance. That brings you transparency, that brings you competition, it brings you value. Today, the federal legislation is unclear about that structuring of how that offering should be made. It requires certain levels of benefits to be offered, pediatric dental benefits to be precise, but it doesn't really hone in on how they should be offered. And because of that, there's no guarantee that dental benefits will be offered in a way that brings choice to the purchaser. We need to change that. So until the next election perhaps settles where this will end up politically, nothing will happen before 2012 at the federal level. Instead, Congress has changed the focus to the states, and they've given the states funding, and they've given them some flexibility. As long as they stay within the general framework that's been passed nationally, they're letting them to tailor this or hone it to their particular geography and particular economic market. And so that's where our fight has to be until the federal issue is resolved. Our fight has to be in making sure that dental benefits are offered and priced separately, and that companies that specialize as standalone dental benefits companies will have the same opportunity for their benefits to be purchased as someone who embeds dental into the medical market premium. So where does this leave us, and where do we go from here? The key is for us to realize there's more to be done. We can't be satisfied until we've made this work for everyone, not just our current members, but for our future members as well. They need to have the same rights, the same opportunities as all those fortunate people have who are covered by their employer plan today, where they have access to coverage from a standalone dental insurer who's an expert in the field, not someone who does this part-time as a hobby. That's what's important about this, is to making the rest of this work. We're going to fight for this the rest of the way. It's important to us, but more importantly, it's important for our members. So we're doing this for you.